Hi, my name is Teresa Williams, and I'm the coding educator for surgery. This webinar is to alert providers of the new 2017 ICD-10 code changes and what will be required in regards to their documentation. The Centers for Medicare and Medicaid Services has allowed a one-year grace period to adjust to the new coding structure regarding the uses of unspecified codes. However, that year is up, and CMS will now expect physicians to document and code with high levels of specificity for conditions that fall within their specialty. Although still allowed, the use of unspecified codes should be rare, and most unspecified codes should fall outside the physician's area of expertise. Effective 10/1/2016, unspecified diagnosis codes would not be accepted for conditions that fall within the provider's area of expertise. For all claims with dates of service on or after October 1st, 2016, you must use the updated ICD-10 codes. If you do not, CMS will reject those claims. Here's some helpful documentation tips. You must document to the highest level of specificity. Update problem list to the most current specific diagnosis. Remove duplicate or conflicting diagnosis. Document according to acuity and specificity. Indicate laterality when applicable. Document cause and effect relationships as well as linking complications to chronic conditions. Probable and suspected conditions should be reported as signs and symptoms until definitive diagnoses are made. Document if the complication is related to the procedure performed or a device, implant, or graft. Specify the type of complication, mechanical, infection, adverse effect of drugs. It is important to note that not all conditions that occur during or following medical surgical care are classified as complications. There must be a cause and effect relationship between the care provided, the condition, and indication in the documentation that it is a complication. Breakdown mechanically of implant electronic neurostimulator or peripheral nerve electrode. Specify if breakdown is for cranial, nerve, gastric, sacral, or vagal. Here's some new codes for cardiovascular, vascular. Hypertension has been expanded to include hypertensive urgency, emergency, and hypertensive crisis. They now have their own code. Hypercholesterolemia has been further defined as familial or pure. Bilateral codes have been added as a code choice for cerebral infarction disease. Previously, unilateral, right or left, codes were available. Now, bilateral codes have been added. You must include if thrombosis, embolism, or stenosis. Specify artery, carotid, vertebral, middle cerebral, anterior, posterior, or cerebellar. Most procedure complications following cardiac and non-cardiac procedures has been now separated by type of problem. Indicate if hemorrhage or hematoma. Identify the cardiac procedure, catheterization, bypass. Identify the non-cardiac procedure. Stenosis of cardiovascular and peripheral stents has been added. Indicate if stenosis of coronary or peripheral vascular. Indicate if initial encounter, subsequent encounter, or sequela. New device complication codes have been added. Indicate if it's due to device erosion, neurostimulator complications, or other neural devices, as well as new inclusion notes. Sequela of cerebrovascular disease codes have been expanded to include separate codes for specific deficits. You must indicate the deficit. Other disorders of the arteries and arterioles have been expanded to include separate codes. Indicate if arterial dissection of unspecified, aneurysm of vertebral, dissection of other percerebral, dissection of artery of upper extremity or lower extremity. Here are some revised descriptions. 2016 code description stated complications of vascular prosthetic devices, implants, and grafts. 2017 has done a revision. It would now state, code description now states complication due to vascular prosthetic devices, implants, and grafts. You must specify the type of complication: embolism, fibrosis, hemorrhage, stenosis, or thrombosis. Indicate if encounter is for initial treatment, subsequent care, or involving sequela. Thank you. Have any questions?